Okay, so the liver, so it starts in the upper right portion of the belly. One of the functions of the liver is to make bile, which drains from the liver into the intestine through a tube called a bile duct. And in your situation, in the lower half of the bile duct, your bile duct was extremely dilated. It had formed what we call a big cyst or cystic degeneration. And this big cyst was, I think, causing some pressure, resulting in you being nauseous on the one hand. And secondly, we get concerned about cysts in the bile duct because, especially in young people over time, they can turn into cancer. Mm. And so what Dr. Chun did about 14 months ago is she took out this area of your bile duct, and then she brought up a loop of intestine and sewed it right here. Mm. So now you have bile duct going into intestine, and this whole cystic area is cut out. So the purpose of the MRI today was to make sure that the rest of your bile ducts looked fine and didn't have any occurrence of the cystic problem. And the answer to that is they do look fine. So the MRI scan looks pretty good today. This area of bile duct outside your liver and all the bile ducts within your liver all look normal. All look normal. And so there's no need right now to do any therapy for your bile ducts.
Okay.
The reason why we still have to be concerned is because even though Dr. Chun removed the major aspect of your bile duct that was causing the problem, you are still at risk for further cystic problems in your bile ducts and even bile duct cancer at a rate higher than the general population. And so what I recommend is that we continue to get MRIs every year for the next few years. Now the question is, well, how long should we get them for? It's a little bit tough to say. There's not a lot of good data guiding us. Mm-hmm. But what I would recommend is that we do it for at least a total of 5 years. An MRI scan is as harmless as an ultrasound. Mm-hmm. So unless you had a pacemaker or some type of metal in you, there's no harm with respect to radiation or anything like that. So you don't have to worry about any of that stuff. So what I would recommend from your bile duct standpoint is that we just get another MRI scan in a year.
Okay.
Now, with respect to your chronic nausea problem, because Dr. Chun sort of did this rearrangement of your intestine, sometimes in the area of your intestine that goes to this bile duct, you can accumulate bacteria, and that can cause some of the problems that you're talking about. Mm. The reason why is because obviously that limb of your intestine is not seeing any food. All it's seeing is bile that's being secreted from your bile duct. Mm-hmm. And what can happen over time is you can build up bacteria in there, and that can cause some of the problems that you're having. So if you're interested to pursue it, what I would recommend is that we do an endoscopy where actually they take a scope, they go down into your intestines. You're asleep during all this. You go down your intestines and they go through the connection that Dr. Chun made for you, and they look at that limb going up to the bile duct. And if there is something abnormal there, they can actually see it. They can sample fluid from there, and they can see whether or not you're having this problem. Mm-hmm. Because this problem can cause issues with chronic nausea. It can cause issues with diarrhea or loose stools. I mean, you're a young, otherwise healthy woman who shouldn't be having those problems. So if this is something that you're interested in pursuing, that's something that we can refer to and have you undergo that endoscopy just to see if that problem is there.
Okay.